Good morning, I'm Dr. Peacock. This morning I want to go over with you a minimally invasive surgery performed to correct the patient who had previously had a Hemi implant done for hallux rigidus. Let me just show you the x-rays first. This is how she presented with us. She had a Hemi implant done some years ago. When it was first done, she had complete relief in pain. This was done by another provider. But you can see now it's kind of closing up on her. What he did was he did a silver bunionectomy and put the implant in the hallux. And this gave her some years of relief, but it kind of started gradually becoming painful for her. And when she presented with us, you can see how her foot now was beginning to kind of close back down here. She wasn't getting any movement in the first metatarsophalangeal joint, so obviously she was beginning to have pain again. Let me show you her foot now. We're about two and a half months afterwards now. What we did, we corrected this with minimally invasive surgery without having to remove the implant, and I'll show you how we did that. Let me just tell you why the implant failed. If you look at her foot, she has a rigid rear foot and a flexible forefoot. But her first ray, she has more supination in range of motion. She has a high CERN perm level. So in that first surgery where they did the surgery on her, the first metatarsal needed to be plantar flexed in order to prevent this from becoming a problem for her. So looking back at her x-rays, and we're challenged with this, what to do with this. I didn't, one way to correct this would be to redo this and put a double stem implant or diffuse this, but I want to try to tackle this with minimally invasive surgery without having to take out the implant. So what I proposed that we do was do an osteotomy, which I call the PRIB procedure. That stands for the Peacock, Revere, Naish, and Bosch procedure, in which we make a cut in the distal diaphyseal bone, move the metatarsal head over and plantar flex as well, then K-wire it with one K-wire from the dorsal aspect like this. What I just proposed to do with this was to keep the stem in place and take a wedge osteotomy distally, go underneath the stem, and sort of like a squared angle to pull the hallux up to give us greater range of motion, leaving the implant in place. So that's what we actually did with her. Let me show you her x-rays today. This is her x-ray. This is the AP today. Here's the osteotomy we did 8 weeks ago. You see some secondary bone healing pretty good. What we did with our cut here, we went distal to the stem and then proximal underneath the stem, so it pulled the toe up. You can even see a dramatic difference now in the actual lateral x-ray. You see how much now our toe is up. I want you to look at this really closely here. See how we were able to maintain the metatarsal plantar flex. You see it stepping down. When we transferred it over, you can see it's actually stepping down here. We K-wired it in this position here. So prior to this surgery, she was getting absolutely 0 degrees range of motion in the first metatarsal phalangeal joint. Now, your foot, your toe, you couldn't move it at all before the surgery, right?
Oh, no.
So there was no movement in the toe before the surgery upwards. So what I'm going to show now, even with her foot loaded, I want you to look at the range of motion we now have. So there's a lot more range of motion than it was prior to the surgery. So this should take care of her pain. And the way we did this, we left the implant in place. We did the PRIB procedure here, and we did a oblique Aiken osteotomy and combined with a bony Kessel to pull the toe up. Okay, just to finish this video up on how we corrected this implant issue that failed with a hallux limitus, I want to talk to the patient as well, and she can tell you give you some indication of how the traditional surgery fared as opposed to the minimally invasive surgery. Let's see our patient. Here is our patient. Let me ask you this: the traditional surgery you had years ago when they put the implant in and made the incision on top of your foot, how long did it take you to get over that surgery?
Oh God, it was months.
Right. How would you compare your recovery with this?
A lot faster.
Good.